Hello, everyone, and welcome to the second episode of Chauffur Talks. We have a very special guest today in the house. Dr. Vito is the
Hello.
clinical director and the owner of Vets and Pets. Welcome on board.
Thank you very much. Thank you for the ride.
Thank you. Thank you for coming. Okay, so Vets and Pets, when did you start? How long have you been in the business? And give us a little bit of a background as well.
Vets and Pets has been a dream since many years. To be honest with you, obviously, I think for every veterinarian, his dream is to own his own place and to create, the environment, a nice environment to work and to to accommodate the clients and the pets. So that is always been a dream. It's been there for many years. In the business, no, I don't. I sound quite old now. Roughly, over 20 years, to be honest with you.
Oh, wow.
I left Italy 23 years ago with a scholarship, and unfortunately, I never came back. Oh, okay, I go home for holiday, right? But professionally, I never came back. I've been working in the UK for many years, and after that, I moved to Middle East, basically.
I think you were in Qatar before
Yes,
moving
I've been in
to
Qatar
Dubai.
for
Okay.
4 years, and then in the UAE now I go for 9 years. And I've been working in Abu Dhabi and now in Dubai. So it's the last couple of years. The Vets and Pets is 2 years old. Soon it's going to be his second birthday. So yes,
That's really cool.
yeah,
Very
it's
good.
nice,
Very nice.
exciting.
Very exciting. And how do you find it different, like between having, like working in this industry in the Middle East or in Dubai specifically, in comparison to Qatar or UK or in Italy?
I think the good news is that structurally, the work in the UK and in Middle East is very similar because the practice is when we establish a practice, the practice covers most of the needs, so it's very well sufficient. So most of the practice they have a lab with an X-ray, with the operating theater and hospitalized wards and hospitalization wards. So a very similar UK structure, I would say. Italy is a little bit different, where we have the small clinic where we have vaccination clinic, and then if a case is a little bit more complex, we send it to other university or big hospitals. While here, like in the UK, practices are well equipped. So the structure is very similar. I would say the case is slightly different. No many lions in UK, but
it's very true though. Yeah.
No, but very similar, I would say.
Okay, that's very interesting. And talking about like very crazy animals or a different type of pets, or
Yeah.
what would be like the craziest thing you've seen in your career?
Well, since I'm Middle East, I've once somebody walked in with an anaconda who could barely fit in the consultation room.
What?
Yeah. Now,
And they have it as like a pet.
yes. Now, I have to say that they were extremely knowledgeable, and that is what makes a huge difference for me. Having an exotical animal, I'm not super keen with the idea, but if there is somebody that really, really cares and they are knowledgeable, sometimes more knowledgeable than us, which is so we can work together toward the welfare, the well-being of the animal. That is something that I appreciate. Yes, but it was an anaconda, and in Qatar, I've seen a couple of lions. Yeah. It's not fun. It's not fun to feel. I felt like food. I never felt like food in my life. I was food.
Yeah.
So it's very weird as a feeling. No, but yes, that other than that, no. Most of the time we see pets or cats and dogs.
Okay.
And parrots and yeah.
Wow, interesting. And obviously you have to like approach them in a different way. Like I think they have to be like, do they have to go under like anesthesia or for a consultation?
We are talking about the exotic.
For the exotic animals.
Yes. But even for a bird examination, most of the time we use a gaseous anesthesia.
Okay.
So to relax them and for us to even sometimes to collect bloods or it's important that it's for their own good. I know that it might sound, invasive or something, or using anesthesia for an examination, but most of the time it's actually to protect them.
Okay, and also like to keep them, like calm.
Yeah, exactly,
Yeah,
exactly.
yeah.
To protect them, so to not to get agitated, and to work properly and faster. That is important.
Okay.
We do it fast. Yeah.
Okay, and what would be like the most complicated case that you've worked on in terms of like a surgery or?
Obviously, I'm quite keen in soft surgery. Okay, soft tissue surgery.
Okay.
Soft tissue surgery. Um, Obviously, tumor removal. Yes, we had from Abu Dhabi. We refer a case of a mass in a spleen, where to do a splenectomy. So when we remove actually the spleen, but the adhesion were incredible in the abdomen, so it was quite challenging. So, but the good news, the little one is doing well. So we're
Okay.
very, 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 very happy.
That's good.
Yes, mainly this, when we are a complicated case, mainly we are talking about hormonal imbalance. Sometimes it's not so easy to spot and to balance. This is what I always say to my clients. If you think, I consider myself a pediatrician, right? I see the little baby, they cannot talk.
Yeah.
So I have to speak with mommy and daddy, and most of the time I have to go through the little it's almost like a detective thing,
Yeah.
So, and when we talk about hormonals, endocrinology, that is where it's more challenging. Yeah.
Yeah, I actually never thought about it this way. Is that when you can't actually talk to them, they can't tell
I
you
know.
what's going on.
That would be fantastic.
Yeah.
For myself, Dr. Dolittle, but no, it doesn't. No, that is just in the movie.
Yeah. So, what would be like your biggest challenges working as a vet here in this part of the world?
Well, okay, so we live in Dubai, and the beautiful thing of Dubai is cosmopolite. Okay, so I have clients from literally all over the world, and sometimes we have obviously different cultural backgrounds, and so also the approach to animal welfare might be different. So it's good for us to make sure that we give that kind of support also, not just medical support, to our clients. Sometimes, obviously, nowadays, I have to say, I think it happens in every business. Nowadays, there is always a Dr. Google, okay, and there are like a social media. Sometimes opinions or facts, they are taken as granted, just because it's online, because I read it online. Sometimes it's difficult for me to actually debunk some myth. Okay, but at the same time, it's a quite good satisfaction when actually I try to explain and to give some data. That's important with data to support some studies and not just theory or opinions. Okay, this I found it very challenging in the beginning. Now, I think there are lots of clients that come to see us. They trust us, so it's getting easier and easier. They come to us and they know if I say something, they're in their own interest, not just my interest. Okay.
So why should a customer choose Vets and Pets? What's the difference between any other veterinary clinic and Vets and Pets?
Well, they should choose Vets and Pets because the other veterinary clinic, they don't have me. Okay. No, I'm joking. Cut this.
That's the only one I'm not cutting.
No, I'm joking.
Why Vets and Pets? What's the difference between your clinic and any other veterinary?
Well, in Vets and Pets, we have we really care about not just the health of the animals, but also the mental health of the animal. I don't know if you're familiar with cat-friendly clinic and fear-free approach. They are two relatively new approach to veterinary clinic, where we actually focus on the stress level of the animals when they visit the practice. So we minimize the stress of cats and dogs when they come and visit us. We have different way of doing so. For instance, we have a dedicated consultation room just for cats, where we have music that cancel the noise outside if there is a yapping dog or something. We have
impressive.
pheromones that calm them down. We allow them to take time to roam and explore the environment. Cats relax quite a lot when they know where they are. Okay, cats are predators, but they're also small, so they are prey. So they want to make sure that the environment they are in is safe first, and then they can allow you to approach them easier. Okay, and dogs the same. For dogs, we take time. We have a dedicated room for dog with easy access to the outdoor. Many times I've done consultation in my garden, because they feel happier. They don't feel like they're close in a tiny cubicle, and there is this strange man with a funny accent wants to poke them with a needle, right? So, and that makes always easier the approach. And it's not just us working better, it's easier for us, but in ways the most important things is the animal is more relaxed and the pet parent is very happy. So all the experience that comes from when they enter the door and when they get out of the door, I want them to feel, okay, this is the place. Everything is nice, everything relaxed, and the flow is nice, is smooth. Okay, so that's why probably I encourage somebody to just pop in and see how it works, and if they they like I'm pretty sure there are many veterinary business in Dubai. They're really, really good. We try to be different in this way.
Okay, well, it's very impressive. Very impressive. I think it's very important because me as a pet parent, when I take my dog to the vet, he usually senses it before we even
exactly
20 minutes before we arrive. He knows something is up.
Exactly.
The second we arrive, he's panicking, he's stressed, starts
and we would like
shaking,
to eliminate that.
So I think it's really important.
We want people to come here like this, enter, being pulled, and not try to pull the dog. So that is the difference, okay? The dog is to be in front.
Dr. Vito, as you know, we're into the transportation side of the business, and we operate the pet taxi, so we transport all kinds of animals, mainly dogs and cats. What would be your advice to us in terms of reassuring the pets? We have obviously some safety procedures that we follow,
which is fantastic.
But of course, would be really good to hear it from you especially in terms of reducing the stress levels.
Well, first of all, I'm glad that you guys exist as a business, because help a lot dramatically. Just taking a taxi and a transportation is not just taking a transportation. If you guys know how important it is to reduce the stress, that makes a massive difference already from home to the practice. Okay, so we can actually work in the same wavelength. For cats, what I would suggest is always to cover the crate, so to cover with a towel.
With a towel.
Crate, okay. So that can help indeed to reduce the visual interaction, so they feel in the same space. Yes, for dogs, obviously, dogs are more relax when their owner is around. Okay, so I know you guys do also a pick up and drop off, which is understandable, which is sometimes and is very valuable, for the clients. But obviously, the presence of the client makes a difference. Makes a huge difference. Mom is around, and I feel happy. And for you to know already that you are not delivering a package, but we're actually moving, a pet. It's already. I would definitely encourage my clients to use a pet taxi and not a regular taxi, or so that's already, for me, is a great thing. It's absolutely a great thing. Probably some, as I said, some calming music in the car. To again eliminate a little bit the noise from of the environment, the outside environment. Okay, in the cat carrier for you, but also for the pet owner, for the cat's owner, I would probably consider to use Furry. There are some pheromones that release a friendly message from the environment, so they can relax during the trip. And for dogs, to use a little bit of treats. Ideally, the treats they use at home. Okay. Obviously, unless we have a gastrointestinal issue. That's why we're going to the vet, and then I will avoid the treats. But generally speaking, to ask the clients to bring some treats with them. Most of the time they do already, but just to encourage the pets. And to calm them down with the treats. So to link, especially for dogs, the trip to a positive reinforcement.
Exactly.
Okay, so this is what my suggestion would be. But already, I think you guys are doing really good, especially with safety procedure. So something happened, what to do, which is very, very important.
Absolutely, yeah.
So I'm quite happy you guys are around.
Thank you so much. Yeah, we try to obviously we try to put as many safety procedures as possible. So as part of the training for the drivers, is actually the first aid training. So in case, obviously, to just cover emergencies, in case something happens on board or a pet's not feeling well. So at least they know the basics of survival. We have few other procedures like tracking collars on every pet that comes on board. Just to be able to track where the pets are all the time.
Very good.
The relaxing music is actually quite new to me. Does this apply only on cats or
cats and dogs?
Cats and dogs as well. Anything specific, or should I like YouTube something specific, or just like the classical music that we listen to?
Yes, no many strings, no many high pitched noises. Almost like a spa type of thing. Music,
spa,
okay,
like a massage.
Exactly.
Okay.
Exactly.
Okay, very cool. So what do you think is the right number of times to visit a vet? So even if let's say my dog is healthy.
Yeah.
What do you think is like the regular amount of time?
That is excellent question. Okay, obviously vaccination time is one very, very important time of the year when your dog goes to fulfill, the vaccination, and which is the main. It's like a main prophylactic things that you can do for your dog. So the prophylaxis is super important. So prophylaxis are vaccinations, deworming, fleas and ticks. Normally we suggest once a year for vaccinations, okay, if they fall into the same day, obviously, and every 3 months for deworming and fleas and ticks. What we normally offer vets and pets is to see also a nurse to check the weight. They can actually administer the deworming tablets, which I know sometimes can be challenging, and the product for against the fleas and ticks.
Yeah.
So the clients they like to come in, check their weight, so they have touch base without seeing the vet sometimes, okay? But generally speaking, at least twice a year, I would see a veterinarian. If they are puppy, we do that already, okay? Because we know we have like a vaccination course, which goes from the second month to up to the third month. Then we have the checkup eventually when they do a neutering, runs around 6 months or so. So it's the end of middle of the year, and then at the end of the year again. We do we repeat the vaccination. But this is what I would say: twice a year with a vet, so to touch base, and every 3 months with a nurse for normal checkup. Make sure that everything, the weight is stable, because sometimes it's difficult. Why he lost weight? Okay, he's playing more, or he gained weight. Well, it was summer, So so we can actually have a look into that in the pattern during the year. I think makes you feel more relaxed.
Yeah, of course. Yeah, it's more like to prevent anything that happening than waiting for something to happen.
Exactly, because the nurse can actually spot the ears of your dog and say, okay, hold on, this is very, very dirty. How come it's so dirty? And then eventually call the vet and we check, okay, there is a beginning of infection. So a couple of drops will sort the problem instead to wait until, the problem becomes visible, okay? Or to check the teeth. It's something that, is very is missed quite a bit, as a concept. Teeth, the health of the teeth is super important.
Yeah.
So nurses just can actually quick check and say, okay, everything's okay, or hold on, we have some gingivitis, some inflammation in the mouth. Shall we call Dr. Vito and have a look? So there is a point of contact, I think.
Okay, and like nowadays, especially after COVID, the more of the teleconsultation is becoming more common, but this is mainly for human, obviously.
Yeah.
Do you think this is something that's doable for pets as well?
I do teleconsultation.
Okay. You guys already do it. Okay, that's cool.
I got a few loyal customers from Abu Dhabi,
Okay.
and sometimes it's difficult for them to travel. And we offer a teleconsultation just for an assessment to understand where what's the concern. Obviously, it's never so thorough like consultation, live consultation, where we can actually check the animal and so on. But at least we can screen
Yeah, at
their
least general
concerns,
things,
and
yeah.
we can actually give some advice. And eventually, if the problem is not solved, then obviously the second step
They can
will be
come and visit you.
obviously to
Okay.
come and see me.
Okay. Yeah, wow, that's really cool. And do you guys do it like just like a phone call, or is it like a video
A
consultation?
video call. So actually, I can see the little rash on the skin, or I can see what's going on. I can see how the cat or dog is walking, or I can see, if there is a limp or if there is a skin problem. Obviously, then the workup needs to be done. But at least we have the first point of contact, and we can help.
Okay, great.
We
Very-
gain time. It's important to understand to also to reduce the worry of the client. So okay, when
Yeah.
they say, listen, it's okay, come a couple of days, come tomorrow, or use this, let me know what's going on, and or you know what, you need to come straight away.
Yeah.
And if you're too far away, go to the nearest vet
Yeah.
and do XYZ.
Speaking about of diets, is there a right diet for a pet? So is there something that I have to like follow, or is it like case by case, or each pet
Yeah, well,
has-
since the advent of the formulas, okay, so formulas are dog food or cat food. The cats and dog life, their span increased dramatically, okay, because they eat better. Sometimes cats, my cats eat better than me, or at least they are better balanced than me, for sure, for sure. They have their own specific amount of proteins during the day, carbs during the day, fat, fiber, and minerals, all there. So it's always very good, very standard. So sometimes I finish work, I go home, I get a pizza. I know it's a cliche, I'm Italian, and it's good, but probably it's not so balanced. Let's put it like that. So when we start using this formula, this cat food and dog food, definitely their life increase and they are healthier. Obviously, there is a food for cats and dogs. Why is it food for cats and dogs? Cats, they need a specific amino acid for their life. Cats are the only pets that is carnivore, strictly carnivore.
Mhm.
So they have to have taurine, for instance. Every cat's food's got taurine inside. So you cannot feed cats with dog food. Well, you could, but eventually they are going to end up with some metabolic issue at a certain point.
Okay.
Then we have food for kittens or puppies, where it's richer in proteins.
Mhm.
Because imagine, for the first year, they go from being like this to adult in just first year.
Yeah.
So we have to make sure that the food is important, support the muscular growth, the joint, the bone. They're going to last for the rest of their life. So make sure that you feed your dog, your cat with a premium diet on the first year. Then you can relax a little bit, you can shop around, you'll see. But the first year is really, really crucial.
Okay.
It's like us, when we are small, our mother give us all the goodies, Then we end up to fast food, So we
True.
should, you know what I mean? So this is also a big difference. And obviously, at the end of their life, when they get, senior, we need to change the diet. Why is that? Because sometimes cats don't need so much proteins, because cats normally tend to have kidney disease. Okay, so we have to reduce the proteins their diet so that the kidney can work better or easier. Okay, and sometimes in dogs we have some food that contains some joint supplements. Okay, so to help them for a potential osteoarthritis. So that is the things. But obviously, speak with your vet.
Yeah,
your vet should suggest you, in every stage of their life, the best diet. And
I know a lot of people are not very conscious about it, or very educated, including me, to be honest. How often do you have to brush dog's teeth or your cat's teeth? And
okay, so let's start with some data. 85% of dogs and cats over 4.5 years of age they have some degree of periodontal disease. Okay, so it's incredibly common. Okay, so it's super important. I explain you a little bit how we reach the periodontal disease. When we finish eating, even in human, it's absolutely the same. When we finish eating, on the surface of our teeth, we have a biofilm, that creates. It's like a network of proteins.
Okay.
We brush our teeth, and it's gone. Okay, so it's great. So if we don't brush our teeth, what happens? From the salival glands, from the saliva, minerals start to precipitate, and they precipitate on this network, so they can actually hang on the surface of the teeth.
Okay.
First, at the surface of the teeth, we have the enamel. Enamel is a very, very resistant material. It's very slippery, let's put it like that, okay? But this mineral, just when hang on these proteins, they can stay on that. So more minerals precipitate, and more your teeth turn yellow. So we have plaque. You can still brush it off. You need to brush it more, to be more energetic.
Yeah.
We can remove it. If you don't do so, more mineral precipitate. You have tartar. And the tartar is that black things on the teeth. Sometimes you see in dogs and cats. So actually, literally a stone. Now the tartar start on the surface of the teeth. Okay, and they start climb, and goes next to the gum. Start to push the gum up. We have recessive gums. The roots of the teeth get exposed. They get very sensitive. Sometimes it goes under the gum and create, this periodontal disease. Periodontals. It goes around the tooth. Okay, inflammation and infection. Okay, the mouth is not a clean place, so it's always dirty. So lots of bacteria. So then obviously you have infection of the mouth, infection of the teeth, and then you might end up losing them. Okay, so a simple regular hygiene will eliminate all of this. Ideally, every 2 years, scale and polish. But after you do scale and polish it, the teeth are perfectly clean. You can use twice a week. It's not even so much. Twice a week, an enzymatic toothpaste. So the enzymatic toothpaste, you don't need to brush it. You just have to smear it in the mouth. And the enzymes, you're going to do what? They're going to break down the proteins that we spoke, the biofilm. So if you don't have biofilm, you don't have plaque.
Yeah.
If you don't have plaque, you don't have tartar. If you don't have tartar, you have healthy teeth, right?
Okay.
So it's important that the vet obviously guides you through this, and it's something that you should do in early age, because I said it's after 4.5 years, 85% of cats and dogs have this problem. So if you start when they are already 1 year old with the procedure itself, they probably don't need it, but doing it, they will understand that it's not something they should be aware of, exactly, or scared of. So they can get used to it. It's a routine for you.
Yeah.
You know that Sunday and Wednesday you do that, and that's it.
Yeah.
You will reduce the amount of time you will need the scale and polish, which you will need eventually during their life, to do it a couple of times probably, but not every 2 years.
Yeah, but many people would think, like, does this really make sense? Because what did dogs used to do before us taking them as pets? And
they used to lose teeth.
They okay.
Yeah.
So they just lose the teeth.
Yeah,
okay.
yes. Well, it's the same for us,
Yeah.
Now we brush our teeth, but in 1700, well, our smile was not so charming. So same thing. Yeah, absolutely same thing.
Okay. Yeah, makes sense. Yeah. Okay, cool.
And then you understand when you have an infection of the mouth, kidneys, they can have a kidney problem. They can have heart problem. The same in human. Yeah, endocarditis or pyelonephritis if there is an abscess in the mouth because of that. So you never underestimate a dirty mouth. Okay.
Thank you so much. This has been very informative. I feel like we covered a lot of important questions.
Thank you for having me.
Thank you so much for coming. And maybe in the future we'll do we can go like live, and where we can get like questions directly from customers, and then we can answer them on the spot as well.
That would be nice.
Okay, amazing. Thank you.
Okay.
Thank you guys for watching. We'll see you on the next episode.
Thank you.